is coming and hitting me. So when Emmanuel hits me, there is a depolarization. Sodium enters into my, now we get depolarized. It carries impulse to my brain and I'll shout with pain, I may hit him back. So it's very simple. Sodium goes inside only, the nerve is conducting impulse. So what is the mechanism of action? Very simple. Your LA has to prevent the sodium entry. That's all. This is not happening in the abscess. I'll tell you why. You inject into the tissue, a normal tissue which is not acidic, it divides into free base and charged particle. Free base penetrates the nerve membrane, charged particle attaches to the receptor site which controls the sodium entry. Next. This is a nerve membrane. So free base enters the nerve membrane. Because the pH change there, it becomes charged particle. And now the charged particle attaches to the receptor site and prevent sodium entry. No impulse is transmitted. Your LA is working. But in abscess, what happens? Infected tissue, inflamed abscess. Less free base. Very simple. If there is no free base, the LA won't enter the nerve membrane at all, no? Very simple. Without entering the nerve membrane, how it will act? That is the reason in abscess, because of the acidic pH, the free base is less. When the free base is less, your lignocaine which you injected not entering the nerve membrane. When it is not at all entering the nerve membrane, how the LA will work? It won't. So how to overcome it? That's why the abscess is in the localized area. You inject there, only these things are happening. Why don't you give it a distant area like here? Block. Why don't you give lateral to the abscess? Why don't you give some drug which has a good penetration like orticaine? Why don't you use a local anesthetic with a buffered material like sodium carbonate? So you add that. These are new things. You can go and read. LA might work. But the solution in abscess is don't get scared. Please take the tooth out. Treat the infection simultaneously by giving a proper block. Anterior, intraorbital. Little bit of infiltration, mesial and distal to the abscess. Combined with PSA for molars. With abscess, you can take it out. Still it's a failure. You can send the patient. House will come after 2 days. Next. So, as I told you, when there is an abscess, you give the infiltration. It will work. These are the small techniques I learned from a teacher and I tried, it's working. Then poking in the periapical region of the abscess. Right? What will happen? That will be a sinus. Whatever injection you are giving, it will come out. And this is a psychological reason, really I don't know, maybe some of the work students, some people, whether it's really true or not. Maybe if I am the patient, 2 people are there. Maybe Kamal Hassan and Nayandara is there. If Kamal Hassan is giving a infiltration, I'll keep saying pain until Nayandara comes and give infiltration for me. People once got treated with that thing, no? And some people say, last doctor gave me 4 injections. It will be working. He will be very adamant. He will be checking everything. A simple technique to check the LA block is lip in between 2 premolars. One more technique I'll tell you, percussive tooth. See, the nerve is not a single fiber, multiple fibers.